Good evening, my name is Heather Wilkes. I am a senior student in the RN-BSN program at Columbus State University. Today I'm going to be talking with you about my evidence-based practice presentation, and I chose to do hand hygiene in the healthcare field. So this is just a list of the few objectives that we're going to go through for the presentation. The first one is going to be determining the need for hand hygiene. We'll also talk about how hand hygiene is often overlooked. Sometimes people think that wearing gloves negates the need for hand hygiene, so we'll look into that. We look into how hand hygiene increases the patient outcomes. We will also look at how to increase the compliance and staff of hand hygiene in inpatient facilities. So as we know, our hands are the #1 vector for infection. We were taught from day one in nursing school that hand hygiene is of the utmost importance. To wash our hands going in the room and wash our hands coming out of the room. My facility that I work at has a thing called gel in and gel out. Not all places have this, but we should all have going in our minds that before patient care and after patient care we should perform hand hygiene. However, this is often overlooked, as I stated previously, that some people think wearing gloves negates hand hygiene. This is really how infection spreads. This is how people get things like MRSA and VRE. This is how people end up becoming septic in hospitals and having to either be moved to a different floor or having to stay longer because of improper hand hygiene of the staff taking care of them. So a lot of our healthcare providers omit it for multiple reasons, omit the hand hygiene, and this really puts our patients at risk. Hand hygiene is very, very simple. It can either be done with, if our hands are soiled, we can wash our hands with soap and water, or we can just go to the dispenser and get an alcohol-based scrub. So for hand hygiene, it is a quick and inexpensive fix. Hand hygiene is something that we can all do. It doesn't take but just a few seconds. Hand hygiene is often not considered as an essential part of patient care, but that should be one of the things that we do. We say, oh, patient care, that is the 6 rights of medication administration, patient's name and date of birth. Hand hygiene should be something that we consider as patient care. Going from room to room without effective hand hygiene quickly spreads infections, and it costs facilities a lot of money to do this. Because it is such a quick and simple task, it's something that we should all do and have in our everyday practice, but unfortunately it's not. So infection rates. Infections are not always caused by, they're not always caused by low hand hygiene compliance. However, it has been proven that hand hygiene does increase infection rates. Approximately 1 in 25 patients in hospitals obtain a nosocomial infection in an inpatient facility. It's estimated that about 750,000 people die from complications of these acquired infections. And when a patient has a nosocomial infection, insurance doesn't pay for that. So the inpatient facilities are actually eating the cost of these infections as well. Many of these infections are preventable through hand hygiene. Who is affected? Everybody in the facility is affected. The patients, the staff, the doctors, the nurses, everybody is affected. Safety is the top priority. Low hand hygiene compliance puts the patients at a risk for a higher infection rate. Healthcare providers who do not practice effective hand hygiene, we're not only putting our patients at risk, but we're also putting ourselves as healthcare providers at risk. We're not really sure what we're exposed to on a day-to-day basis. So hand hygiene not only helps our patients, but it also helps us to keep ourselves safe as well. The facilities are greatly affected. If a patient acquires a nosocomial infection while staying in an inpatient facility, it decreases the Medicare reimbursements for this facility. And this is something that the facility I work at has really taken account of on the Medicare reimbursements. If this patient, when they have initial labs when they get there and there's no infection, however when they leave there is an infection, that can really, really affect the facility, and the facility ends up having to pay for this infection. In 2007, about 750 hospitals in the U.S. were penalized due to due to the infection rates secondary to low hand hygiene compliance. 750 hospitals. That is a very high number. So, regarding infections, MRSA, methicillin-resistant Staphylococcus aureus, is the most common antibiotic-resistant bacteria. We all have had patients who have had MRSA, but it is spread through direct contact, hand-to-hand contact. If we're touching a patient without gloves, if we're touching a wound, if we are, get some kind of bodily fluids on us and we don't properly wash our hands when we leave that room, and either when we go to the break room and touch the doorknob, or we go and do something with our other patients, that is spreading that infection from that person. According to Zimmerman, MRSA is a culprit of approximately about 11,000 inpatient deaths, and the cost of MRSA is about $35 billion annually. And while not all of these infections are preventable, a lot of them can be prevented with hand hygiene. There are multiple reasons why healthcare providers may not wash their hands or adhere to a strict hand hygiene policy. Some of the reasons could be, that they think that wearing gloves negates it. Yeah, I have gloves on. I touched the patient, but I didn't touch him with my hands. I don't need to wash my hands. That is the thought of some people. Maybe they forgot. Maybe they were super busy. Maybe the staff members' hands were full and they said, oh, I can't wash my hands. I'll put on gloves. It'll be okay. It was an emergency situation. I work in the ER, and a lot of times things go wrong very quickly, and hand hygiene is at the back of your mind. You throw on gloves and you go to work. Hand hygiene is not the top of your priority list, even in the emergency situations it should be. Staff had frequently entered and exit the room. We go in, we go out, we go in, we go out for supplies. We're getting called in and out, whatever it may be. But even though we're getting called in and out, we should still gel in or wash our hands every time we leave and come out. And the no sink and hand sanitizer dispense was readily available. Sometimes we are in an area where it's not readily available, but it should be made readily available. This is some of the reasons that staff may not wash their hands the way that they are supposed to. But it is essential to make a change to make sure that all staff of all facilities are aware of the infection rates and why a change needs to be made. The change for hand hygiene is really important because it allows our patients to be safer due to less risk for increased infections. Strict hand hygiene is essential for our patients as well as our facility. We don't want our facilities to get docked for these infections that these patients have contracted while they were in the facility. By strictly adhering to hand hygiene protocols, patients are at less risk for infection. I know that's been said multiple times, but that is the main topic here, that by washing our hands thoroughly and becoming strictly adhering to hand hygiene, this can help our patients tremendously. There are several ways we can make changes. First of all, you would want hand sanitizers, sinks, and soap, that kind of thing, to be made readily available in all departments, as well as throughout the hospital. You also want to provide education to the staff on the importance of hand hygiene. Another thing that could be done would be to provide visitors of the facility, family members, friends coming in to visit, provide them on the importance of hand hygiene as well too, because we are all spreading it. Us as nurses, we are in direct contact, but they are as well, being in a hospital, visiting, So it is important that our visitors as well have good education on hand hygiene. Another thing we could do is have performance feedback from management. The management could monitor infection rates, infection control. We can see if, after providing education on hand hygiene, if the infection rates have increased, if they've been stagnant, if they've gone down. That way the staff can know if they need to better their hand hygiene or if the infection rates are getting better. Patient outcomes, I know we've said this over and over, but the patient outcome is mainly that they will have a decreased risk for infection. When the healthcare provider adheres to strict hand hygiene, the patient is at lower risk for infecting a hospital-acquired infection, which we know can be very dangerous to the patient. It can be lethal in certain situations, and this just isn't what we want for our patients. They come to us to get well. We shouldn't be, through our hands giving them other infections. Improvement at my facility. I believe every facility has room for improvement when it comes to hand hygiene. At the facility where I work, we can provide education to our staff. I see people using the Germ-X and rubbing their hands, or I'll see people occasionally washing their hands in the sink before touching a patient or doing any kind of patient care. But it should be in our minds. When I walk in this room, I'm going to get some Germ-X. When I walk out, I'm going to get some Germ-X. Or before I start this IV on this patient, I'm going to wash my hands. After I start this IV, I'm going to wash my hands. I have to go assess this patient. Let me wash my hands. That should be in our minds. Hand washing should be, top priority. It's very simple to do. After that, we provide education. Management can provide feedback, as we were saying earlier, on the infection rates, how each staff is doing, if one staff does have a higher infection rate, if the infection rates of the unit are going down. We can know if our hand hygiene is effective or if we need improvement. We all have obligations to hand hygiene. Every person that walks in the door that clocks in to go to work, whether you're a nurse, you're a doctor, you're a PA, you're a tech, you're the CT tech, you're the EKG tech, anybody who is walking into a room to perform any type of patient care is at an obligation for hand hygiene. Hand hygiene lowers the patient's stay at a facility by decreasing the risk for infection. It also lowers the cost. As we were saying earlier, the Medicare reimbursements do not come if the patient acquired an infection. So washing our hands and decreasing the patient's infection rate can really help the patient go home quicker, as well as their stay be cheaper. So the conclusion here is that hand hygiene is vital. It is a simple task. It doesn't take very long. Sometimes it does take a little bit longer to wash our hands with soap and water. The alcohol-based hand sanitizer is just as effective. Hand hygiene allows for better patient care. It allows us as nurses to provide the best care for our patients, make sure that they are safe, and make sure that they are infection-free. And all healthcare providers are responsible for this. Do we have any questions? Awesome. Thank you. This is my reference page.